was exhausted. It was the type of fatigue where you get into bed and you wouldn't want to take your shoes off.
This is Hannah. It's 2017. She's 20, a student in Dublin, and about to visit her brother in London. The night before, her parents noticed some odd behaviour.
I had lost the £200 that I got exchanged from euros to pounds, and I didn't really seem to understand, the fact that I had lost the money. I was kind of like, it's okay, it doesn't matter.
She struggles at the airport.
I got lost and I started to cry. And when I got to London, I couldn't find the exit, even though it was very clear.
At dinner that night, her brother is worried.
I was just very kind of in my own little world, difficulty keeping eye contact, difficulty maintaining a conversation, jumping from one topic to another.
On her return to Dublin, Hannah's condition gets worse.
I went from just being a bit forgetful and a bit absent to my speech becoming very slurred. I had a bit of a stutter as well, to my behaviour becoming very erratic, very anxious. I'd feel like my brain got fuzzy and I felt zoned out. It was very, very scary. I felt like I was losing myself.
Hannah's mum assumes it's stress-related. There's a lot going on in her life. Losing her grandmother, a relationship breakdown, as well as studying and holding down a job. She goes to her GP.
I said to her, I am not mentally sick, but I couldn't really speak. And she turned to me and said, you are mentally sick. And she said it very kind of definite. And I looked at my mum and I just had tears streaming down my face, kind of like, please help me.
Hannah is prescribed antidepressants and drugs for anxiety, but they're not working. She eventually agrees to see a psychologist, then a psychiatrist.
And I was screaming inside me, will somebody help me? And then next thing, about 15 minutes into the consultation, the psychiatrist said, I don't think it's psychological. I think it might be neurological.
I'm Guy Leschziner, a consultant neurologist in London, and this is Phantoms in the Brain, a 4-part series about the relationship between mind and body, how physical and mental health are closely entwined. In this episode, how psychiatric symptoms may not be all in the mind. 3 weeks later, Hannah is diagnosed with autoimmune encephalitis, a rare neurological disease caused by inflammation in the brain. It can be hard to diagnose. Many of the symptoms also feature in psychiatric illnesses like bipolar disorder and schizophrenia. So perhaps it's not surprising Hannah's mum thinks her daughter is mentally unwell. But there are some telltale signs that help decide if this is a mental health disorder or whether there's something else going on in the body.
We're one of possibly only 2 clinics in the UK where every patient is seen simultaneously by a neurologist and a psychiatrist.
Here are colleagues Tom Pollock, a neuropsychiatrist, and Esther Coutinho, a neurologist, both from King's College Hospital in London.
Very sudden onset could be a clue. Most psychiatric illnesses tend to come on over the course of a number of months or even in some cases years, whereas for these autoimmune diseases and for many sort of organic causes of psychiatric problems, it's often in days or weeks and in some cases even sort of hours.
Agitation, aggressive with psychotic symptoms, hallucinating with delirium, with delusions.
So the fact that Hannah's symptoms developed very suddenly, her behaviour changed rapidly, is an important clue. But there are others too.
One of the sort of red flags we talk about is the level of disorientation and confusion that a patient shows. They're often very disoriented to time, to where they are, and even to who you are or who they are or who their loved ones are.
This would explain Hannah's sense of confusion at Dublin Airport, a place she's known all her life, or her inability to answer questions from the psychologist about her job.
She just asked me questions about myself, and I remember just feeling very attacked and very confused because I didn't know what the answer was.
But we can't always rely on symptoms alone.
So far, my clinical experience is that even the most seasoned sort of neuropsychiatrists frequently get it wrong.
There are other tools to help decide whether this is primarily a psychiatric illness or if it stems from inflammation in the brain. A blood test for antibodies that target the brain can help, but it's not reliable on its own. These antibodies can sometimes be found in entirely healthy people. And even if patients do test negative for certain antibodies in the blood, they may still have an autoimmune condition, perhaps triggered by an antibody that's not yet been discovered, or caused by another feature of the immune system.
We're still in the infancy of these diseases. I'm sure that there are other immune-mediated encephalitis that are not just dependent on the presence of an antibody.
Brain scans and an EEG recording the brainwaves can also be entirely normal. Increasingly, we test the fluid around the brain and spinal cord using a procedure called a lumbar puncture. This involves inserting a large needle into the base of the spine and drawing out the fluid, but there are downsides.
If a patient is enormously distressed, perhaps paranoid, or in other ways psychiatrically unwell, this isn't always a very easy thing to ask, but also not an easy thing to have patients agree to.
For Hannah in Dublin, the lumbar puncture is the breakthrough.
My dad got a phone call saying, we know what's wrong with her.
The neurologist rang me and said, the results are just in. He said, Hannah has NMDA, autoimmune receptor encephalitis. Basically, her brain's on fire. There's no cure for it.
The antibody attacking Hannah's brain was one of the earliest ones to be identified by scientists. This field of autoimmune encephalitis is relatively new and is fast evolving. Neurologist Esther Coutinho.
Yes, it's hard to keep track. We are recognizing more and more antibodies, but we don't really know what are the clinical characteristics of these new antibodies because they have been recognized in such small numbers of patients.
When I was at medical school, neurology and psychiatry were very much separate subjects. And to a large extent, that is still very much the case. Yet it's clear from the cases in this programme and throughout the series that there's so much overlap between the two that it may make no sense to consider them separately.
It would be as if my chest was just thumping, my heart was trying to get out of my chest. Very, very hard thumping quite in quick succession.
It's 2017, and Kat is in her 20s, fit, healthy, with a high-powered job in the city and a busy social life.
I had this deja vu feeling all the time.
Don't do it!
I continuously thought that I'd been somewhere previously, even if everyone around me was telling me I'd never set foot in that location in my life. I was convinced I'd been there because I had some sort of memory of being in that exact scenario before. It could be the person, a place, it could be a sound, anything, even a song that I'd just been released, or a film that had not come out yet. And it was the first time it was being shown in a cinema, and I was convinced I'd seen it before because a particular bit that happened on the screen felt like it had happened before in my mind.
Kat is also struggling to remember things.
My memory was just absolutely atrocious. I couldn't remember things people were saying to me. Maybe 10 minutes before, I'd completely forgotten.
There could be an obvious reason why Kat has developed these symptoms.
It sort of coincided with my sister being diagnosed with cancer. My nephew was 18 months and my niece was about 3. I was working full-time in the city, so I was commuting every weekend to my sister's, looking after the children whilst she was having chemo and whilst she was recovering from surgery, and then commuting back on Monday mornings. So I also was incredibly exhausted.
Kat's dad, Jack.
It was shock, and it hit Kat and her brother very badly. Just out of the blue, mortality suddenly strikes, and at that stage there was no guarantees about what the outcome would be.
Kat's GP treats her symptoms as a classic case of stress and trauma and sends her to a psychiatrist who recommends talking therapy over many months. That helps the anxiety.
But the déjà vu and the palpitations, they didn't change.
An important clue that all may not be as it seems. On top of all this stress and anxiety, Kat is becoming increasingly thin, even though she's eating normally.
I was looking at the scales and it was just going down and down and down. At the same time, my eyes were starting to bulge out, and sort of one of my friends said to me that they looked like they were going to pop out of my head at some point.
This is all happening during lockdown, so most of her doctor's appointments are done remotely, not face to face, where perhaps Kat's condition might have been picked up sooner. Her psychiatrist starts to wonder if there may be another explanation for what's going on.
He thought actually this could be not a psychological problem. It could be triggered by something underlying, at which point he referred me to a neurologist just as a precaution.
So we have Hannah initially on a psychiatric ward in Dublin, and now Kat in London under the care of a psychiatrist. In both cases, their doctors are beginning to think it might not be a mental illness after all, that these symptoms, which sound very psychiatric, may well have a physical cause, that the body, the brain, is unwell, not the mind. To be fair, these physical conditions can be difficult to diagnose at the best of times, but Kat, with her multiple problems, makes it a far trickier job.
Everything was amalgamated and triggered at the same time, and so they were sort of wading through a minefield of symptoms and trying to distinguish which was what. I could barely remember my name or where I lived, so I'd sort of lost control of my body. I think I was just terrified of what was happening to me, because I was also shaking all the time, very, very aggressively. My brain wasn't working. I couldn't remember any of my childhood, any of my university days, any conversations I was having with people. I was missing massive chunks of my life.
How did you cope at work with that sort of memory impairment?
Very badly. People were noticing that I was forgetting to do things. I'd forget conversations I'd had with people, so I tried to work on that by making these meticulous notes and by making sure that I'd put reminders in for everything, absolutely everything. My alarm was buzzing every 10 minutes, just telling me what I needed to do next. Even things like water my plants.
Kat sees the neurologist and also a hormone specialist. Within a month, she's diagnosed with not one, but two major illnesses. Graves' disease, an autoimmune condition that results in an overactive thyroid gland and causes the eye problems, potentially also explaining the anxiety and palpitations. And epilepsy. The déjà vu and palpitations result from seizures arising in the temporal lobe of the brain, both physical illnesses that have been driving these psychological symptoms, making it seem she's mentally unwell. What did you think when you were given at least a diagnosis?
Very, very relieved that there was something that could be done. That they could give me a tablet that would mean that I would go back to normal, my personality would come back and my brain would start working as it has before.
Not quite that straightforward. Kat is put on a drug to treat the thyroid problem and anti-epileptic medication for the seizures, but with lots of side effects. And yet the seizures with their sense of déjà vu continue, and Kat's anxiety levels remain high. A year later, she's referred to me. I remember you coming in and being incredibly anxious, talking very rapidly. You were quite fidgety, you were quite tearful, and you'd had so little response to the anti-epileptic medications. I'm going to confess something to you now that I probably won't have confessed before, which is I wasn't sure at that time whether these were epileptic seizures or whether they might be what we term non-epileptic seizures, which are driven by psychological conditions. A recording of her brainwaves, a prolonged EEG, quickly clears this up. She's having more than 50 seizures a day, I did wonder whether or not actually the underlying cause for your seizures, and indeed your anxiety, was an autoimmune condition. Whether or not there was an antibody that was driving this condition. A blood test shows the presence of low levels of an antibody, called anti-GAD, directed against elements in the brain. But this antibody is common in people with diabetes, and healthy people too. Do you remember me telling you the results of the lumbar puncture?
I remember it being scary, horrendously high.
When we looked at this antibody in your spinal fluid, it was off the charts, really, which gave us a very clear indication that the epilepsy was not straightforward epilepsy, that was actually being driven by something else. The spinal fluid result confirms that her anxiety and seizures are actually being driven by an autoimmune attack on her brain. At the height of the COVID-19 pandemic, everyone is nervous about suppressing their immune system. So we go with an alternative treatment, an infusion of immunoglobulins, a collection of antibodies from thousands of healthy donors, which can help.
My seizures went down to about 2 a day from about 20. I actually got a little bit of relief. My brain wasn't under so much stress.
Kat's recently started treatment. A colleague has prescribed a powerful drug that suppresses the immune system. She's pretty desperate.
I think my words to him were anything. Just anything. I don't care what you've got, just if it'll make it better, I'll take it. I'm not so fussed about the immunosuppression anymore. I just need some sort of relief from this.
How often are you having the seizures at the moment, Kat?
At least 8 times a day, and they're getting stronger. It'll be extreme shaking for that 30 seconds with the deja vu. Sometimes I even have complete scenarios playing out in my head that have never happened. And the more dramatic ones, the shaking will continue, normally on my right side for a couple of minutes after. Sometimes it's been even longer.
And what about the memory?
Still appalling.
Anti-GAD, has only really been recognised as an entity for the last few years. Our knowledge of these sorts of rheumatological treatments is expanding rapidly. There are now a barrage of these treatments that I had never heard of a year ago and weren't in existence 2 years ago. Actually, things are exploding in terms of possibilities. But this brave new world of autoimmune neurology comes with risks. Esther Coutinho and Tom Pollock again.
It's a fine balance between identifying the ones that need immunotherapy and not overly treat patients with primary psychiatric disorders.
Just because you have a positive blood result of one kind or another, that doesn't necessarily mean that you have an autoimmune brain condition.
We receive a lot of these patients in our clinic. Obviously, their families are desperate. They want a biological cause that can be treated.
I do think that for some people, and this is quite understandable, it may be preferable to have a sort of organic brain diagnosis than it would be to have a psychiatric diagnosis. What that means is we really have to try a lot harder still as a profession to help destigmatize some of these psychiatric illnesses.
These drugs that we give, not only do they have risks, but they can, in cases, be fatal.
Absolutely. I often think that, in the future, clinicians will say, do you know that doctors in the turn of the millennium used to treat autoimmune diseases with full immunosuppression, destroy their immune system? Barbaric.
It's October 2017. We're back in Dublin, where Hannah has been in hospital since August, diagnosed with anti-NMDA receptor encephalitis. She's getting worse, mentally.
Not understanding things that I was being told to do, and that's kind of when I really started to lose myself. I wasn't there at all anymore.
And physically, she can't walk, talk or eat, and is completely incontinent.
My whole body just was frozen, and I started to get that kind of rigor mortis in my neck and my hands. That's when I went kind of catatonic.
Neuropsychiatrists Tim Nicholson and Tom Pollock. both at King's College London.
Catatonia is a really interesting syndrome of what we call psychomotor retardation. The psycho bit is to do with your thoughts, and the motor is to do with your movement. Patients become almost statue-like and immobile.
It's one of these disorders at the sort of junction of neurology and psychiatry, really.
Catatonia has traditionally been associated with schizophrenia. And in fact, we know now that it's very common in general medical syndromes, predominantly those that affect the brain.
It's this sort of freezing and lack of responsiveness.
It was like being trapped in my body. So the directions that my brain would say, such as to lift up that cup, my hand wouldn't follow the direction. I would just stay completely still. My whole body just wasn't connected to my brain. No signals were being transmitted. It was just, I was like a kind of stone statue. I think I weighed like 6 stone, 5 pounds, and I was just getting worse and worse. So they told my parents I had about 2 weeks to live.
My name is Derek. I'm Hannah's dad. They always said keep talking to her. Even though there was nothing. Her eyes were open, there was just a blank. And I used to... Her eyes, do you see, was there ever a blink? Never a blink.
During that time, the hospital tries various treatments, including steroids, immunoglobulins, plasma exchange, which involves filtering out the antibodies from circulation.
Apparently, in my disorientated state, I would try to pull out these tubes out of my neck and my chest. My dad has quite a distressing memory of him pinning me down to the floor, sitting on me, trying to get me to stop.
Finally, they try a powerful immunotherapy drug, an infusion that suppresses the immune system.
The first thing I remember is my dad crying and Disney music on in the background.
So, my wife had told me that she loved the movie Beauty and the Beast.
And my parents used to play the soundtrack to me when I was unconscious, with the hopes that I might hear it and it might provide me some comfort.
And I put the earphones in and I put them into her ears, probably for about 15 or 20 minutes. And then I stopped. And then my wife said to her, as she would always would, Hannah, are you tired? And next minute we hear this very faint yes. We looked at each other and I said to him, and did you hear something? He said, I thought she said yes. So she asked her again. And Hannah said, yes. Everybody comes over and we're all crying.
Excited that I had said my first word in 3 months. And then next thing he started to record me.
Hannah, say Dad. Say Simon.
Say Hannah. Hannah, we love you. Say we love you.
Good girl. Oh, love you. Oh, we do too.
Hannah's emergence from her catatonic state, caused by the NMDA receptor antibodies damaging her brain, is a long time coming.
2 weeks after I had those infusions, that's when I woke up. In total, I was in hospital for 105 days.
Hannah finally leaves hospital, able to walk and learning to talk again.
So I don't think I've made a full recovery, but I feel like I've reached a recovery that I'm happy with. And I'm very lucky to say that.
It's a miracle, because we can't explain it. She knows she's been given a second chance and she's grabbed that with all her might. She's marvellous.
Let's hear from Kat and her dad, Jack.
And I also got lucky with my family, my boyfriend, that I actually had that support to pick me up. Sorry. To pick me up off the floor every time I fall. Sorry. Which is quite a lot at the moment. Yeah.
Kat, the fact you've been able to come out of it, your sister's been able to come through and make things happen, that has been really impressive to me. The story of life, as it's sort of portrayed in some of the media, is a long way from the reality that's out there.
For over a century, we've recognised that conditions of the brain, like tumours or epilepsy, can mimic psychiatric conditions. But current advances in the world of medicine are making us think differently about what is a mental illness and what is physical.
Take epilepsy, for example. It was not too long ago that epilepsy was viewed as a result of demonic possession. Later down the line, it was viewed as a mental illness, as a psychiatric illness, and now it's viewed very much as a neurological illness because we know what causes it.
Somebody listening to this might say, well, I've got OCD, I've got depression, I've got anxiety, I've got mania. Should I be going for tests? Should I be considering whether or not I've got an autoimmune driver?
That's an absolutely fundamental question. Perhaps we're a long way from knowing the answer. But it's also a question of what do you do with the results? You have to take it in the wider clinical context. And I think there's a real danger of giving false hope, perhaps, to patients.
These conditions are breaking down the barriers between the physical and the mental, uniting the worlds of neurology and psychiatry.
A great neurology colleague and mentor of mine once said to me, well, the brain and the mind are in the same box, which is the skull. So it's very clear that clinically that means that we should be considering all of these disorders together.
Hannah can speak from experience.
I've realised how much there's a link between psychology and neurology and our physical health. And I think part of the reason why I wasn't diagnosed is because psychology and neurology don't talk to each other and they don't link up. And I think there is a gap there that we could learn so much from if we just teamed up together.
In next week's episode, how psychiatric disorders like depression may be linked to physical changes, and how OCD may be treated by neurosurgery.
Phantoms in the Brain is presented by Guy Leschziner. The producer is Sally Abrahams. Call You and Yours is coming up just after the midday news. Felicity Hannah has all the details of today's programme.
Today on Call You and Yours, we're asking what's changing on your high street. New analysis by the BBC shows traditional retail in our towns and cities is in decline. But it's not all doom and gloom. We're still hitting the high street for services like hairdressers or food and drink. So how is your high street doing? Is it dying or is it innovating and thriving? Are your streets